Hi guys, in this video I'll be talking about dyslipidemias and hyperlipidemias. So what is dyslipidemia? Dyslipidemia is abnormal amount of lipids and it can be lower or higher, hypo or hyper. But hyperlipidemias are mostly seen in developed countries because of high calorie diet, high carb, high fat, high calorie diet. And high carb or high carb especially diet increases the level of insulin and that can cause dyslipidemia. And if you're talking about heredity, OGT gene is involved that mainly causes dyslipidemia. Now, talking about the regulation of your lipids in your blood and in your organs, there is specifically lipoproteins that do this works. So, lipoprotein is a biochemical assembly whose primary purpose is to transport hydrophobic lipid. And it is classified into chylomicrons, VLDL, IDL, LDL and HDL. VLDL is very low density lipoprotein, IDL is intermediate density lipoprotein, LDL is low density lipoprotein and HDL is high density lipoprotein. Now the chylomicrons are the largest lipoprotein with VLDL to HDL decreasing in size. Now there are apolipoproteins as well. And apolipoproteins are proteins that bind lipids, oil-soluble substances such as fat and cholesterol to form lipoproteins. And there are some important apolipoproteins that we need to remember, such as ApoB100 that is found in VLDL, IDL and LDL, ApoB48 that is essential for chylomicrons, and ApoBA1 that is found in HDL. Now, lipoproteins can be calculated by this formula, that is LDL minus cholesterol is equal to total cholesterol minus VLDL, that is 1/5 of the triglycerides minus HDL. And the table below shows the summary of measurements of total cholesterol, LDL-C, Friedwald and HDL-C by this formula that is written above. So now, moving forward, talking about HDL. HDL is very important as it has a very protective role in the body. It decreases cholesterol by transporting it to liver, and it is also helpful in sepsis because it removes toxins and also maintain endothelial function. APO1 that is found in HDL inhibit calcium-induced procoagulant activity. The ideal ratio of cholesterol to HDL by American Heart Association is 3.5:1. Now moving forward to dyslipidemias, first we talk about primary dyslipidemia. And it has several types, type 1, 2, type 5 and type 2 has further subtypes, type 2A and type 2B. Now first talking about primary dyslipidemia, the cause of primary dyslipidemia is gene mutation, disturbance in lipoprotein level because of the gene mutations, premature heart disease, family history, cholesterol above 240 mg per dl in serum, and hyperlipidemia physical sign, yet you can see your lipid aggregation on the skin on the body. Now talking about the types, type 1 is familial hyperchylomicronemia. In this, the chylomicron are increased in the serum and there is low level of LDL and altered ApoC2. Now, the clinical feature you will observe is pancreatitis, lipemia, retinitis, skin eruptions, xanthoma, and hepatosplenomegaly. The treatment is not by any drug. The only treatment is by diet, and the serum will appear creamy top layer, which is showing chylomicron. You will also see creamy top layer in type 5, that is endogenous hypertriglyceridemia. And you will also observe your creamy top layer because of there is also increased chylomicron in the serum. Now talking about type 2, there are two subtypes, type 2A and type 2B. In type 2A, that is familial hypercholesteremia, there is decreased LDL receptors and increased LDL in the serum. And the clinical feature you will observe is xanthilacemia, acus senilis, tendon xanthomas. Now the treatment is by several drugs, there is statins, niacin, cholesterol, and cholestyramine. The serum you will observe is clear. You will observe clear serum because there is no chylomicron there. Now, type 2b, that is familial combined hypocholestemia. It is combined because there is your VLDL also increase in the serum, LDL as well as VLDL, and there is decreased LDL receptor as well as increased ApoB, apolipoprotein. Now the treatment is by statins, niacin and fibrates. Now moving to the type 3, that is familial dyslipidemia. There is defect in ApoE2 synthesis and increased intermediate density lipoprotein in the serum. We will observe eruptive xanthomas and palmar xanthoma, and the treatment is by fibrate and statins, and the turbidity is because of the presence of your IDL in the serum. Now moving to type 4, that is familial hyperlipidemia. There will be increased VLDL production and decreased elimination of the VLDL, and the increased VLDL will be causing your dyslipidemia. Now the treatment is by statins, niacin and fibrate. And now the type 5, endogenous hypertriglyceridemia. There is increased VLDL production and decreased lipoprotein lipase production. Now the VLDL and chylomicron will be increased, and the chylomicron will show creamy top layer in the serum and turbid bottom as well. Now the treatment is by niacin and fibrate. In all these types, the most common type is your type 4, that is familial hyperlipidemia. So now moving forward to secondary dyslipidemias, there are several causes, and there are several presentations. Like if there is increased LDL, the causes may be diabetes mellitus, hypothyroidism, nephrotic syndrome, obstructive liver disease, drugs such as beta blockers, thiazides, steroids and progestins. If there is increased triglycerides, there is your same diabetes mellitus, hypothyroidism, obesity, renal insufficiency, drugs, beta blockers, estrogen or triclopidine. Now the decreased HDL level, you will observe that in secondary dyslipidemia will be caused by cigarette smoking, diabetes mellitus, hypertriglycemia, menopause, obesity, puberty, uremia, drugs, anabolic steroids, beta blocker and progestins. Now talking about other types of dyslipidemias, there is very high LDL and very high triglyceride. The cause of very high LDL is defective ApoB B100 apolipoprotein, and the cause of very high triglyceride is your obesity, your physical inactivity, cigarette, excess alcohol intake, high carbohydrate diet, type 2 diabetes mellitus, renal failure, nephrotic syndrome and other certain medications. Now the treatment, as you know, is basically of two types. You have either drugs or you have to modify your diet or other lifestyle. So as far as the lifestyle modification is concerned, you have to increase your physical activity, you have to give up alcohol, cigarette, and you have to change your diet. You have to decrease the amount of calories you get from fat, and you have to regulate, increase your fibrous diet, proteinous diet, and you have to decrease your total fat intake on total carbohydrate. You have to regulate your carbohydrate intake as well. Now as far as apart from the lifestyle modification, the treatment is by drugs, and the drugs that are used are bile acid binding enzymes, nicotinic acid, ezetimibe, HMGA-CoA reductase inhibitors, and fibric acid derivatives. Now talking about summarizing the drugs, what drugs basically do. Bile acid secretins actually decrease the cholesterol by binding into bile acids, and they are basically the most safe your alternative for statins, and the basic only major side effect is your GI constipation. Now talking about nicotinic acid or niacin, they decrease LDL and triglyceride and increase HDL. They also, you have to monitor liver enzymes and glucose while giving these drugs, and the side effects is flushing. Now talking about zeta, it actually decrease cholesterol in blood and also decrease LDL. The major side effects are your dizziness and back pain. Now the statins decrease LDL drastically, about 18 to 60%, and the side effects are myalgias and abdomyolysis. Now there are fibric acid derivatives as well that decrease triglyceride, raise HDL and increase LDL size but not the number. The side effects are gallstone and dyspepsia. So that's it for the topic of dyslipidemia and hyperlipidemia. Thanks for watching.